Good evening, everyone. Normally, you would be seeing Councillor Graham Bridgman, who is Deputy Leader of the Council and Executive Portfolio Holder for Health and Wellbeing and Chairman of this board. I believe he's trying to connect at the moment. So I'm Councillor Jo Stewart and I'm the Vice Chair. So while Councillor Bridgman is attempting to reconnect, I'm going to start the meeting for everybody. The other members of the committee in attendance, and I will just check who is here. I think we may have some apologies, but I can certainly see Sue Halliwell. I can see Steve Masters. I can see Andy Moore, as well as Meriden Peachy, Matt Pearce, Joe Reeves. Have I missed anybody? I have. Sean Murphy and Mark Lewis and Martin Dunscombe are also joining us, as well as my Executive Director, Andy Sharp. Now have I missed anybody? Thank you to Jack, who is our host tonight, and hopefully will be keeping us all on track and keeping the tech going. Do we have any apologies, Jack?
None that I am aware of.
Okay. Well,
Joe, from Martha Vickers, and that's I'm subbing for her.
Okay, that's great. Thank you very much, Andy. Okay, the first item on the agenda is to check if the minutes of the meeting on the 6th of September are a true and correct record of the meeting, or if there are any changes required. So does anybody have any changes or any questions? If you were in attendance at the last meeting, it would appear that nobody is signalling at me. So in which case, can I seek I'll propose them from the chair. Do I have a seconder? Thank you, Steve, Councillor Masters, for that. So we have a seconder. Item 3 on the agenda is declarations of interest. So do we have any declarations of interest from members of this board? We don't. Fantastic. I'm just going to check in with Councillor Bridgman to see if he's able to join us. Otherwise, I will continue. In which case, I will continue. If you can hear us, Councillor Bridgman, do shout when you're able to, and you're very, very welcome to take over. Okay, thank you. I think we may also now have joining us, is that Katie Summers has also joined us today? Yes, hello there. You've got Joe Reeves as your name at the moment. That confused me slightly.
I'm sorry about that. I haven't, for some reason, I cannot find the actual invite. So I'm not Joe Reeves. Joe Reeves is here, although we both wear glasses. I'm so sorry about that, Councillor.
That's quite all right. Katie, is this your first time that you've joined the LOEB?
I have been here once before, but I'm going to become a standing member going forward because I lead the vaccination programme across Berkshire West. So okay. It's lovely to meet everybody, and hopefully I can provide a lot of helpful contribution.
I'm sure you can. Thank you very much, Katie, and welcome. We are going to go to item 4 on the agenda, and that is an education service update. And I believe it is Mark Lewis from the Education Place Planning and Development, who is the Education Place Planning and Development Manager, to give us an update on the COVID situation within schools. And in particular, this is following the first 2 weeks of the school term. Just before you start, Mark, I can see that Councillor Bridgman has raised his hand.
Yes, can you hear me?
Yes.
Right, I'm going to leave you in the chair, if I may, Joe, for the moment, because I've got 2 different computers, both rebooting. I'm working off my phone, and I can assure you, because this is the first time I've tried to use Zoom on my phone. It's an interesting experience, so I shall watch and learn, if you don't mind. You Absolutely. Don't want me trying to join in from this beast, so I'll leave you to it and just listen.
You keep fighting the good fight with technology. Thank you. Over to Mark.
Thank you, Councillor Stewart. It's been a positive start to the term, albeit very busy indeed. I'll start off with sort of summarise the sort of numbers of cases. So and we're still counting. We are currently at 513 cases since the beginning of term, and that includes the week immediately after the bank holiday, where schools were doing the LFD, on-site LFDs, and some were open and some weren't fully open. So that week, the following week, and last week, we're up to circa 513 cases in total, of which the biggest proportion is within secondary, the secondary phase. Primary phase accounts for about 27% of the current total figures we've seen so far this term. Schools where they've had cases, they've been dealing with them like they've always dealt with them, very professionally and calmly, and it seems like parents generally are doing the same. Everyone's sort of working together on this where there are cases. Like any group of people, some are more concerned about the level of cases than others. Schools are getting used to the new guidance and the new way of operating following the changes in legislation at the very end of last term and over the summer holiday period. Levels of anxiety are manageable at present. Everything seems to be going okay, setting aside the large number of cases. Schools are using the guidance. Schools are aware of the guidance. We've provided quite a bit of guidance and templates for them to use. And the health and safety team have provided risk assessment templates. They've got all of those templates, and they're using those and the guidance. They've got their plans in place and the risk assessments in place. But we have there's been quite a large number of queries, clarifications over the last few weeks. We've had to spend the vast majority of our time providing advice and support to our school colleagues. I think some of the concerns that are coming out at the moment is staff absence through being poorly if numbers do continue at these high levels. But at the moment, I think generally so far so good. So it's just been a very busy 3 weeks. The case numbers per week. 182 the first week, 168 the second, and 163 last week. And as I say, we're still getting some numbers coming in from some settings, so that's likely to go up slightly over the next few days.
Thank you.
My update.
Thank you, Mark. I haven't got any hands raised at the moment. Has anybody got any questions for Mark? Matt?
Yeah, it wasn't a question. I think it's just more of an appreciation to Mark and his team, actually, because I think it's been probably what's coming up to 18 months now of ongoing support for schools. And I know the schools have certainly appreciated the work that Mark has done and his colleagues in providing advice, support, often out of hours during quite difficult times. So it's just really a thanks to Mark. And I know schools have clearly played their part and gone above and beyond, but just wanted to pass on my appreciation.
Thank you.
Thank you, Matt, and absolutely. I think, and there were lots of nods around the screen for that. So thank you very much. Thank you for joining us. You're welcome to stay, or you're welcome to head off if you've got lots of things to do, Mark.
Thank you very much.
Thank you. On to item 5, which is one of our standing items. So the COVID-19 situational report from Matt Pearce. Matt, over to you.
Thanks, Councillor Stewart. So I've only got a few slides this evening, which I'll take you through. I'm pleased to say that actually since we last met, which was a couple of weeks ago now, we've seen a dramatic improvement in our COVID position. So I'll just take you through in terms of what the data is currently telling us. So the slide you'll be familiar with, which is the usual summary. Obviously, we have all the local authorities on the left-hand side. And I've highlighted West Berkshire with that blue bar around. So in terms of individuals tested, all local authorities and South East and national data suggesting that is decreasing. We've seen a dramatic decline in our positivity rates, almost halved over the last 2 weeks or so. So we were just shy of 10% positivity, and that's now standing at 4.6. So again, that's the proportion of individuals that actually test positive when they go for a test. And again, that's reflected across all the local authorities and the regional national picture too. And equally, when we look at the cases per 100,000, again, West Berkshire was the highest only a couple of weeks ago. In fact, across the south east, we were the highest in terms of our rates of all ages. I mean, we now shot to the lowest across Berkshire and lower than the regional and national average. So now at 178 per 100,000. And then cases per 100,000 for the 60 plus, we're looking at 83. So again, a reduction in rate there. And it's a slight variation between the local authorities there, but again, it's all in a positive direction. So in terms of the number of confirmed cases over the last 7 days, it's 282. And there's been 3 community outbreaks. And in total, we've had just shy of 12,000 confirmed cases of COVID-19 so far. So again, after we just look at the epi curve, you could just see on that right-hand side, the blue line representing West Berkshire, the orange line representing South East, and the grey line representing England. You could just see that dramatic drop where we've also gone quite high to quite a low position. But again, we're still seeing, 200 per 100,000 isn't low by any means, but clearly it's a much improved position. And again, it's just 45% reduction from the previous 7 days. In terms of explanation for that, clearly the testing has been a key part in identifying young people as they go back to school. So that's likely played a significant factor in identifying these cases, although it doesn't necessarily provide the reason why West Berkshire was higher than the national regional average. We have had some data from Reading that suggests that about 5,500 individuals tested positive that attended Reading either 2 days or 7 days prior to the festival. But not all of those would have been West Berkshire residents. So that's across England, South East, South West, the Midlands, and a small portion of those were actually Berkshire residents. So we're continuing to do some analysis on that. That may have played a small contributing role amongst a number of other factors. Then again, if we look at the rates by age, again, you can just see the age range on the y-axis on the left-hand side and the x-axis on the dates. And we can just see there's that slight reduction in the rates as you go down the age ranges. And you can see that quite prominent really from the 25 to 59 in September. And as we go down towards the 11 to 16, you can see that that's where the rates are still highest amongst that age group. And again, I shared this graph a couple of weeks ago. This is just the testing rates per 100,000. So again, I think last time I showed that we saw that dramatic increase in testing as children and young people going back to school, the green bar representing 11 to 16, and the amber, the 7 to 18-year-olds, obviously it went up a lot higher than obviously the other age ranges. And obviously we've seen that drop off now as the schools have completed their twice weekly testing. In terms of patients admitted to hospital, my understanding it's relatively stable. So there's been a slight increase, but it's relatively stable. There's no new COVID-19 admissions on the 12th of September. You could maybe see a slight upward trend, but we're not seeing that same level of hospital admissions as what we saw back in January and obviously May last year. And there's nothing really reflecting in those rates that we've seen over the last few weeks into hospital admissions, although we would probably have to wait a few more weeks just to see how that plays out in the data, because we know that there's obviously a delay from people getting COVID to being admitted. And then in terms of patients in hospital, again, it's relatively stable. It's been fluctuating between probably 20 to 40 patients, I'd say, over the last few weeks or so. And it's remaining that way. So again, we're just keeping an eye on that and seeing how that plays out over the coming weeks. But clearly the vaccination is playing an important part in that data. And then with regards to deaths, again, you'll be familiar with this slide, the orange bar representing non-COVID deaths, the blue representing COVID deaths, and that grey bar is the weekly deaths average between 2015 and 2019. So again, the rise in rates that we've seen probably since middle of last year to September, we're not really seeing our excess mortality rates going higher than that 5-year average, which again is good news. And again, just showing the success of the vaccination. We are seeing the odd COVID-related death, but over the last 2 weeks, we've not seen any deaths. So again, that's really positive news. So that's all I was going to cover, Chair. I think I saw a hand pop up from someone.
Yes, thank you, Matt. And just wanted to say really interesting points about the festival. Certainly, those of us that live sort of nearer the Reading side of the district, it's one of those conversations that has been had quite publicly about, oh, well, clearly it's, you know, all these young people that have been attending the festival, but we all know that people come from across the country to attend that event. And so all of the good work that we've been doing in this area to make sure that we are vaccinating our young people and that sort of stuff, you can't say, oh, well, that's that, you know, that's the single reason. But it's really interesting to hear you say that, and also interesting to hear what further analysis you might have about why we had that sudden peak. But great, thank you, Matt. Yes, Councillor Masters.
Thank you, Chair. Thank you, Matt, for the update. I've been keeping an eye on the figures myself, and it was quite striking the drop off in the 2 weeks since that peak after Reading, and whether or not that was connected or not, as you say, the research will continue, I'm sure. We're in the middle of September now, and it's really reassuring that death rates are considerably lower than they have been over the last 18 months. But looking at some of the figures in terms of cases and hospitalizations, and I think nationally there's still quite a number of deaths in other areas. This time last year was quite a quiet and low numbers period of the pandemic. Can we expect, and what's been done to mitigate the expected, or if it reflects the the number of cases going into autumn and winter like we had last year, what's been done in the background to so we can keep people aware of what the ongoing risk may be, although the vaccine is obviously having some effect on hospitalizations, etc. We still can't be too complacent. Would you agree?
I would agree, and I think you're right in your terms of your statement. We're clearly, our rates are higher than what they were last year, but clearly we are, like you say, in a different position because we've got vaccinations and they're being hugely successful. I mean, we're continuing to put in place a range of measures ongoing. Mark's just talked about schools, and we're continuing to provide support for schools. Obviously, we continue to follow national guidance, and obviously the new government winter plan's been published. There are additional measures we can draw upon if we feel the need, both in an outbreak situation and wider community transmission. So we continue to give the same messages in terms of obviously people continue to get vaccination. I'm sure Katie will talk about the booster programme going forward. Equally around influenza and flu vaccine, we're keen to do that. In terms of predictions and modelling, it's really difficult to know what the outcome is going to be, purely because it's really hard to understand how the public will behave. And that's a challenge we have in terms of understanding what winter's going to look like. Clearly, people are going to be mingling more inside, and the ventilation measures is going to be really important, but that will prove more challenging, I guess, as we head into the colder months. But yeah, and I'm sure Martin will talk about the communications that's ongoing as well in terms of regular testing and things like that, and supporting the hard to reach to make sure people can play their part.
Great, thank you, Matt.
Thank you, Matt. Thank you, Chair.
Thank you, Steve. I'm thrilled to be able to say that Councillor Bridgman can now be seen on screen, and we can hear him as well. So over to you, Chairman.
Well, thank you for such a sterling job. I'm living an interesting life with one computer's just kicked back into life, but it's telling me I don't have enough USB resources to run the camera. So, who knows? So I'm afraid you're looking at me on my phone. Members, the next item is our normal item of the agenda item on vaccine program update. But if you recall, at the last meeting, there was a request to also have a piece on the 12 to 15 vaccination program. So I think we've got two angles to this. We've got Katie standing in, as it were, for Joe, or certainly coming along to talk to us about the general program, I hope. I hope she's not surprised by that. And Ginny, and I welcome Ginny from Berkshire Healthcare Foundation Trust, who will be and are running the 12 to 15 program to talk to us. So, ladies, I will leave you to decide who's speaking first, how you're speaking, what you're doing, and wait to hear from you. Thank you.
Okay. Ginny, shall I start off? And then when I get to the 12 to 15, I'll stop and then you take over. The only
Yep,
request I would actually have is, at the moment, I can't share my screen. It says here that actually I'm disabled from sharing.
Sorry, you've been made a co-host now, so you should be able
Okay.
to.
Sorry, say that again, Jack?
You've been made a
Oh, I
co-host.
can
So
see.
you should be able to
right.
screen share now.
Yes, thank you. Right. Okay, so thank you very much for welcoming me to this meeting. I am going to use this programme to just give a quick update, reflections of the beginning of the programme, then cut into the next stage, which also would incorporate the 12 to 15, which I will hand over to Ginny. So this is just a sort of summary, and I thought it'd be really good for us to all just to recap on where we are as such. And it was very hard, I think, for me when I was trying to prepare this presentation to think, when did we all start this and the journey that we've gone on? And it has been a journey. It's about not only the NHS. I'd want to thank here the work of the council, the volunteers, the trusts, everybody in really promoting the vaccination programme. But generally, we kicked off with the actual programme back in December. And then we rapidly started to work towards actually implementing lots of different sites as part of the actual cohort rollout plan that we had. The bottom of the figure is the data of the actual position against the Buckinghamshire, Oxfordshire and Berkshire West system. And I would like everybody here to recognise that Bob Integrated Care System is the best integrated care system in the country with actually vaccination uptake. We have done incredibly well with the actual programme itself at the moment. We're now moving into a new phase, which is about boosters. But I'd want everybody to recognise here, even if those people who haven't had their vaccination to date, and obviously that's now down to the actual the 12 to 15-year-olds, they still have an evergreen offer. So they can still go along to many of the sites that are available to them to have their vaccination. So I'm not going to talk about where we are here. So I'm going to just reflect on the stage 3 booster programme. So the stage 3 booster programme was actually announced on Monday. And we are in the stage of actually rolling this programme out. The first stage is very much focusing on the residents in care homes. And for those individuals, the expectation is that they all have to be vaccinated or be offered a vaccination for the boosters by the 1st of November. Everybody on the actual booster programme will be offered a Pfizer boost. So actually, this is a key thing to note. Everybody who's actually have to have an actual gap of 6 months between their second dose and their booster programme. Anybody who's immunosuppressed, that gap is reduced to 12 weeks. So it's a slightly different situation for anybody who's immunosuppressed. The stage 2 will be actually obviously focusing on the cohorts that we subsequently had, which was for the over 50s and the 16 to 19. But at the moment, the real focus is on those people in care homes, plus also the over 50s as well. So that's the key target of this going forward. This coming, go. Here you've got a bit more information about the actual programme for the phases of the actual programme itself. I've put more details. For some reason it's duplicated and I don't know why. I'm sorry about that. These are some of the delivery mechanisms that we're going to be using in the actual programmes itself. So in the past, when we did the phase stage 1 programme, which was obviously back last December, we had the opportunity of having the Newbury race course, which was utilised by all the actual GP practices and their associated primary care networks for local residents to visit. For this phase, PCNs that will be available for practices will be the Kennet PCN and also West Reading Villages PCN. The other local residents, which obviously count for the actual A34 PCN, which is Strawberry Hill, Downlands and Eastfield House, as well as West Rural Villages, they will have the opportunity to go along to some of the actual pharmacy sites, which is incorporated into the Nabs Lane Pharmacy, which is in part of the Kennet Centre, Boots Pharmacy, which is the one in the actual main shopping centre, which is just outside, and also Lambourne. They will also have the opportunity to go along to any of the mass vaccination sites. And this is quite significant, especially for the significant West rural villages, because they would be able to go to the mass vaccination site at Swindon as well. So there is opportunities for West Berkshire residents to actually be vaccinated. We have actually done some due diligence of this work to make sure that we have every opportunities for West Berkshire residents to have an opportunity to come forward for their boosters. But obviously, we will keep on reviewing this as we go forward. We will be continuing with the Health on the Move van, which was utilised for the hard to reach group. However, at the moment in October and November, the Health on the Move van has had to be halted to allow for the actual vaccinating of the 12 to 15-year-olds. So we have some changes of this going forward. So I want to make people aware of that. Homeless people will still be vaccinated by the lead GP. So we did do some really good work for the homeless people. And actually that will still continue. We're doing pop-up sites like we did beforehand. Housebound patients, we're actively talking about this with Berkshire Healthcare Trust, so there'll be a mixture of both the community nurses, but also I expect some of the actual PCNs and the practices will also be doing some of those housebound patients. At this point, I'll just slightly hand over to Ginny because she can give you a bit of an overview about what's actually happening with the 12 to 15-year-olds. So Ginny, I don't know whether you wanted to come in here.
Katie, could I just hold you there for a moment and Ginny, because Andy's got his hand up and I just wondered whether it's a question in relation to what you've just said, Katie, and then let Ginny come in. So let's deal with questions on what you've just said. Andy.
Thank you, Graham, and thank you, Katie, for the presentation. It's just a question on the vaccination boosters for staff who work in social care. Obviously, we had an arrangement for the previous vaccination programme round where we had PCNs going into care homes to vaccinate staff. We had access to resources at BHFT and a variety of targeted resources for care staff. I just wonder what the arrangement is going to be for those care staff this time around and how easy it's going to be for them to access. Are they going to have to use these same routes that you just talked through, or will there be specific programmes for those staff, again, alongside health colleagues?
Thank you, Andy. So for any resident of care homes, obviously they will be vaccinated by the relevant practices itself. The practices may choose to also vaccinate the health and social care workers, but it will be down to the individual PCNs in order to make that. What we've been advised nationally is that the hospital hubs, which would have been in the past Berkshire Healthcare Trust, which helped us in that first round, they are unable to support the health and social care workers this time round. And that's purely to do with the fact that they have got a major workload to do with immunisations and also the vaccinating of the actual schools IMS. So for all health and social care workers, what will be happening is the fact that they will be notified, and the comms is going to be released over the next week about this, that they will be actually be able to go book on via the MBS site. So that's a national booking service. On that service, they will be able to go along to a local pharmacy, which we've increased the number of pharmacies. They could go along to one of the PCN sites as well as also going to the Broad Street Mall, which is our local actual mass vaccination site, but they could also go to Swindon. I think, Andy, you are part of the group here, and we will be actively monitoring what is the uptake of the boosters for the health and social care workers. And I'm very keen to make sure that we continue to monitor that on a regular basis to see what the uptake is. And I will ensure there's flexibility if we see that we're not seeing the health and social care workers actually coming forward with the boosters. I'm very much aware that this is a critical thing, especially for social care, because those individuals need to be vaccinated. So I'm actively worrying about this at the moment, because we've got to be ensuring that they do have access and they get the access at the right time.
Thank you for that, Kate. That's really very much appreciated. Obviously, we'll do everything we can to support that process as well through the local authority. Does bring me into a follow-up question, though, that based on what you just said about PCNs going into vaccinating care homes, how are we going to be picking up those care homes that are in areas that won't be covered by one of the PCNs that signed up for this process? Will there be a separate arrangement for that? How will that work?
So at the moment, I'm working that through at the moment. So I'm having active conversations with those PCNs to see whether or not that is a possibility that they can go in and vaccinate those care home residents. It is quite a big workforce, but I would say that they have an offer at the moment, and that they do their core general practice work within those individual care homes. So I will probably be able to give another update about that over the next couple of days to confirm that is going to be the arrangement.
Thank you.
Before we move on, Katie, can I just clarify the distinction between care home residents and care home workers, and whether there is a difference in the way in which you are delivering?
For care home, yes, so there is a slight difference as such. So for care home residents, the GPs all have a what's called an enhanced service, a contract that they have to sign up to in order to deliver vaccinating the actual care home resident. It's slightly different for health and social care workers as such, because that's part of the general sort of vaccination programme itself. It's not necessarily that they are contracted to vaccinate the health and social care workers.
I recall that in the first round of vaccinations, there was a deliberate move to basically vaccinate everybody who was in the building, regardless of status, in order to get the vaccinations going. That won't be happening this time round.
This is the slight difference of the change, really, which is actually that's what I'm saying is I'm actually worried about, because in the past, that's what we're doing. But I'd want to probably assure the board here that you have got very, very mature and very, very conscious primary care networks. And I would say that the Kennet and West Reading PCNs, but also I would also think about the other PCNs that you have, A34 and the West Rural, will be actively thinking about the health and social care workers. So we'll have to actually see about what actually happens, whether or not they will do exactly what they did beforehand and actually offer doing their own registered patients and actually doing those workforce as well when they go into an actual care home.
Okay, thank you. Right, so having discussed one end of the age spectrum, let's move to the other end. Ginny, would you like to talk to us about where we are and where we're going with the 12 to 15 programme?
Right, so can everyone hear me?
Yeah.
Okay, so good evening, everyone. So firstly, just to let you know that we actually worked with the CCG back in the late, sort of around August, around delivery to the clinically extremely vulnerable in the special schools. So we were able to visit the 2 special schools in West Berkshire, which obviously will have residents from outside of West Berkshire, but we did deliver there in the second week of term. Also, Katie's just talked about Berkshire Healthcare's inability to do the rest of the workforce. That's because when we did do the COVID vaccinations, it was mostly my INS team that were doing it because the schools were closed and we couldn't do our routine INS. The reason I mention that is because our staff have been used to the delivery of the Pfizer vaccine. There's been a couple of delays really by the centre in terms of there's some bits of paperwork we haven't got and certain things, but they're coming in. The plan is that we must have offered to 100% of the eligible cohort by the 22nd of October, and originally we were supposed to have completed then, but as we didn't start last week and we're unlikely to start until Thursday, that the delivery time will be set back. I'm not sure if everyone is aware that this coincides with an increased cohort for the delivery of the childhood flu. So last year we delivered to children from reception year to year 7, and we were notified in March that we were delivering to from reception to year 11. So that was for us as a trust, that's an extra 50,000 young people. And I'm afraid I don't have the numbers broken down for West Berkshire. Again, we've been waiting for confirmation as to whether we can co-administer the COVID jab with the flu, and we have now heard that we can. So we've been working with the lead provider through the ICS around supporting with staff. And we're not quite where we want to be, but we think on Thursday that we will go ahead with St Bart's School being the first school. To prepare for this, and I don't know if you want this, we have held 2 webinars for schools. So all head teachers were invited to give them some information, kind of FAQs really about, you know, a parent objects, but a young person consents, that kind of thing. And actually we developed our own information pack for parents and for head teachers, and I think I sent those to Katie. Yesterday some national resources were published. Initially, we were told nationally that because all immunisations programmes are commissioned by year group, and the first national webinar we attended, they said it would be year 8 to 11, which made things simple for us. They've now said that it's any child who's reached their 12th birthday. From a safety point of view, I am not prepared to vaccinate in schools any pupil in year 7. And the reason for that is the drug is not licensed to under 12s. Therefore, we will capture those children at the end of the programme, which will be early November. That's the safest way, I believe, that we can run it. I think the risk of a parent perhaps intentionally giving a wrong date of birth is too great. And we don't, the sessions are very frantic, they're very busy, they're very safe. We don't have access to their health records to check that at the time. The other moving goalpost is we were told years 8 to 11. Yesterday, when the specification came out, it says, and any of those in years 12 and 13 who haven't been able to get to a vaccination centre. We currently haven't consented those because we didn't know until yesterday. We use a digital consent process, so schools get a link, and then each school has a unique URN code, or I don't know, but digital code, and that's where those consent forms go. It's all web-based and secure, and we do allow self-consent, and I'm sure everyone has read lots of conflicting ideas, and in fact I have to say the guidance from the government doesn't always help. It says what the law states is that if a young person has been assessed as GILIC competent, then you can give it, and that's not just it's quite an in-depth conversation. And we are also aware of the Court of Appeal ruling regarding Bell v. the Tavistock Clinic, which was announced on Friday, which overturned and ruled in favour of the Tavistock Clinic. Now, that was around puberty blockers, so we're quite clear about it, but we are getting a lot of email traffic around that. The normal route is that parents, as I say, receive an email through the schools. They distribute it, and they then link in and complete a consent form, and we do also ask them to complete it even if they don't consent. After the vaccination, they get an automated email, and that includes information on side effects, and we've updated that to include those really rare side effects of the myocarditis and actions to take. In terms of inequalities, our normal process for immunisations is we ask the local authorities to either provide us with the details of those who are home educated, or sometimes there's information governance concerns over that. So more often than not, we provide the information that can be sent out from the local authority to those families who are deciding to home educate. There's obviously other families who are, at risk of inequality, and we're also aware that we've got a number of asylum seekers, so we'll be addressing those separately because they're unlikely to be in school. And we will be notifying Newbury College, that kind of place where they don't have a huge amount of young people, about how those pupils will be able to access. It's very clear in the guidance that there's no ability for parents who say, well, I don't want it done at school, I want it done by my GP or through my local vaccination site, except for those that have specific risks, and severe allergy being one of them. And that's a severe allergy that's landed them in an intensive care unit. And we have a process in place for that. There will be some young people who are classed as clinically extremely vulnerable who attend mainstream school who won't have been able to get their jab yet. So again, we've included in our questions if their children fit into that, and then that allows us to triage it, and then we will have a referral system to the GP. At the moment, we are told that this is a one-dose programme, but actually what the National Consent Form says, which is, it's not really a consent form, but it says for one dose at the moment. I can't remember the exact words. So we anticipate it will be a 2-dose schedule, and it's very clear that if it is a 2-dose schedule, we will be consenting them twice. Unlike we do another programme that's 2 doses, and these parents sign the consent form just the once, but this will be twice. We've tried to put kind of all sorts of safe systems of work around, obviously if a child has had a positive PCI within 28 days, we can't give it in the school, so they'll be called to a clinic. So we will run local clinics. I think that is probably about all. So we have a programme. We are reliant on our colleagues from the Bob ICS to support us with staffing, because we, for obvious reasons, do not have enough staff, and we are being advised that they will redirect staff from the mass vaccination centres. So for West Berkshire, that will be from Broad Street Mall, and they will be directed to attend schools with our team, but it will be our team who are leading the sessions. So I don't know if anyone's got any questions.
Well, let me kick off. Firstly, you mentioned about having it now picking up years 12 and 13 who might not have already been jabbed. Have you got any idea what the numbers of that cohort are looking like?
No, I think what we will have to do, I mean, that I read that in the spec yesterday. I mean, I think anecdotally, what I believe is that the year 12s and 13s have been quite energetic in getting their jabs, because it means that they can go to nightclubs and things like that. So I think they've been quite good, but there will be some who, for example, it's either Bradfield or Padworth College we've been approached, because they've got some borders there, so for them to get out and go somewhere. So we probably won't be able to do it for St Bart's tomorrow, or whatever we're doing on Friday, but I think we will have to just say if there's any other young people who haven't had it and they want to self-consent. There's no issue with the over 16 self-consent. There's a lot of misunderstanding about self-consent for people with children of a younger age. And I think we've got to be sensitive. We've got to, we do work with parents. We get this for other programmes. Yeah.
Graham, I've got the data on the 16 to 17-year-olds. So at the moment, the last update I actually had, which is actually a couple of days out of date, but for West Berkshire, 64.7% of 16 to 17-year-olds have had their first vaccination. So at the moment, the total population for 16 to 17-year-olds in West Berkshire is 3,893. So that means we've been able to vaccinate 2,518. I would think, I generally want to say that that percentage number is fairly high. We are doing exceptionally well with the 16 to 17-year-olds across the region with that vaccination update. So although it might say a bit low, 64.7%, actually, when we compare ourselves across the whole of the South East region, we're doing very, very well.
Yeah, the only thing I would add to that, Katie, is of course we have, particularly around the Thiel area, we have children, young people who may live in West Berkshire but educated in Reading, and live in Reading, educated in West Berkshire. And school IMS are commissioned on a school attendance, not by residency basis. So when we produce figures in future, it may not match yours, but that's the reason why it may not match.
Okay, so the second question, it may be far too early to give even give a view on this, which is the proportionality of yes and no to consent.
Well, earlier today, this is St Bart's, and St Bart's we would generally expect a very high uptake. So for flu, I think we'd had something like 900 odd positive consents. And I believe today at about 4 o'clock, we had 470 for COVID. So the consent forms kind of closed down because we have to go through a process of triaging them and dealing with any clinical queries. So they closed down 24 hours, 1 working day before the session. And because of the vaccine and the kind of currency, if you like, of the vaccine, we are going to have to be very strict. You know, you get 6 doses out of the vial, because now that we're moving the vaccine, which there is a protocol, any other vaccine, if I take it out of my fridge here and I pop along to St Bart's and I don't use all of it, I can put it back in the fridge. I can't do that with Pfizer. So we will have to be very rigorous in our vaccine allocation. Hence the reason to, well, that's not the only reason why we shut down the form, because we do need to do the triage, but we do need to make sure that we've, not wasting vaccine.
Okay, so for parents and students who have not consented, let's take St Bart's as the example.
Yeah.
Have not consented in this round, what is open to them in the future?
Right, so we've just discussed that with our digital consent provider today, because what happens is we close the consent form down and they then get an error message and they think the system's broken. So we've just agreed today to change it, that and I can't remember all of the details, but they will try to go into it and it will redirect them and say, we've closed it down today, and there is going to be a redirection. And what we're trying to avoid is numerous phone calls into our office, because we just cannot cope with the volume, is to make sure that we've got information on our website, and that we will also pass information to schools about, if your child, because there'll be other children who miss it because they're unwell, whatever, they're hiding in the toilet and they don't come down. So there will be community catch-up clinics.
Thank you. Matt.
Yeah, hi Janine, and thanks for that. That's really, really helpful. Just a couple of things. Obviously, there is some I guess, controversy in some elements of the press around the different advice and guidance being issued. And I was just wondering, are you coming against any resistance from schools? I know some schools are being pressurised, actually not necessarily schools, but pressurised from outside sources around legal ramifications and so forth. So I was just wondering if you're coming across that, because one of the things I wondered we should maybe do is put some factual information on our website, or whether BHFT are already doing that, to just inform parents about the evidence in terms of what the evidence is telling us around the vaccinations and why they're being used, and the different advice from JCVI and the CMOs. So is that in a pipeline, or is that something you need some support with from public health?
I'm not aware of any West Berkshire schools refusing. I could tell you certainly some schools in Slough. I had a very long email from a gentleman in Slough, and I've responded, and he's found that quite helpful. I think we could certainly send the latest guidance, the government one about, it sort of talks about what happens if I refuse but my child consents, what happens if I consent but my child refuses. It is confusing, because it says legally that, if the child is Gillick competent, they can do it. But we tell our, the school age immunisation service will contact you. Well, actually, we won't if the child says, no, I don't, look, my mum doesn't want me to have this. I've read it. I know what I want. I'm whatever, we would encourage them, but we wouldn't override, because actually that's going against the law. And, the law is very, very clear around what is Gillick competence, and it's context specific.
Yeah, that's really helpful, Jenny. Thanks. I think it's just factual information about the risks of vaccinations, or the benefits.
Yeah,
it
is.
Being clear that's all we can help you with. So happy to support you on that.
I'm happy to forward on. I'll try not to forward things that you don't need. You can imagine the size of my inbox. I'm surprised it hasn't exploded with information that's coming in. But I'm happy to share that, Matt.
Thank you.
Thank you. And Katie.
Yeah, so on that point, I think it would be really, really helpful is actually having the conversations with the Director of Educations in West Berkshire Council to allow them to ensure that the individual schools' websites could have some useful FAQ sections on the website, so they could actually support that. I can actually help Ginny with that and actually do some collaboration work to make sure that we can ensure that the actual Directors of Educations could actually then liaise directly with the schools to do that.
We did invite, sorry, Katie, we did invite the Directors of Education, so Ian Pearson, to the webinars. I don't know if they attended, because we didn't take it, you just sort of dialed in, you got a link to the webinar. There's the information that we've produced for head teachers and for parents, and then I think it's pretty much aligned. Someone's just said Ian did attend. I think we're aligned, but we were really conscious that actually we couldn't wait until, I think it was yesterday, I'm sure it was yesterday, that all the information came out from the centre. So and as I say, we're quite happy to share it again. And a couple of the GPs have been on calls that we've been a party to, so that we are aligned. The vaccines, what I didn't go on to say was the vaccines do go on the national system. We've informed parents of that in our system, which eventually does feed through to the GP.
The other thing, Councillor, I'd want to support Ginny in this is one of the key risks that we have, and this is across all areas, and Merredin's going to know what I'm going to say here. It's to do with the anti-vaxxers campaigns. We are seeing material going into GP practices, but also being communicated to schools, which some of the material has headed paper on. It is either from Public Health England or from NHS England that they've then adapted, which is actually causing a lot of anxiety and angst as such going forward. So I think that's something that the local outbreak engagement board, if we could get support and help with that, to actually really let people know about when they ever get some material in that actually is causing any angst, could they literally raise it to myself and Joe as soon as possible. These are all now being raised by the police as well. It's an active thing that's actually being really, really monitored going forward at the moment, but we are starting to see an increase in this activity.
Yeah, the team have had, we've had one very abusive email, which I've responded to, and with the advice, it was a bit of flu, and it was a bit, it was just generally very abusive. And I shared that with our head of security, and we've gone back and just given a very curt, you're entitled to your opinion. And we share abusive emails, the kind of standard thing that we get. But anything that's come, which we've now had a significant amount coming into the inbox and threatening individual staff, as well as the organisation as well. And we are following the regional advice of everything gets escalated up, and actually we're not going to respond to them. We've also given some advice to our staff around their own personal safety, because we're going to get darker mornings and darker evenings. So and we've, as part of our request schools, we are requesting on-site parking for those who are carrying equipment, because we feel that we know that parking's a premium in many, many schools, but actually we do, there's a lot of kit to carry, but also you don't want them carrying it up in lugging it up the lane or whatever, and being a target for anti-vaxxers. We need to get our staff on site and protected.
Thank you. I'll move on to this anti-vaxxer question in a moment, but just make sure no one has any questions for either Katie or Ginny.
Can I just finish just showing one slide, if this
of
is
course,
okay?
Katie. Of course.
Yeah, sorry. So I've just sort of a final slide, just to sort of summarise the position about where we are at the moment. So I think this is a really important slide to share. So for the first vaccinations for the phased 1, which was obviously the top priority groups, you can see here from West Berkshire. Before you
continue, yeah. Katie, can I just clarify, because we have this conversation with Joe every time about, yeah, are you picking up those PCNs, particularly my end of the district, which aren't on the same system as the other PCNs? Does this data pick them up?
Yes, this data is actually from a system called Foundry, which is the national system which incorporates everybody. Okay, so this data is from Foundry. So this does incorporate everybody. So at the moment for West Berkshire, in that first phase, you are 94.7% compared to Bob of 92%, and across the national picture, which is 90%. So you can see here, there's a massive, massive increase. For the 18 to 41-year-olds, you're on 81%. For Bob ICS, it's 73%. And then obviously I've just shared with you the actual data on the 16 to 17-year-olds. And then equally on the second vaccinations, you are still performing well above the Bob integrated care system, as well as the national picture as well. So this is a big thank you, because this is a collaborative approach. Don't underestimate the fact that it's not just the primary care networks, it's public health, it's the volunteers, it's you counsellors who are doing a massive job here to encourage everybody to come and be vaccinated. So well done.
So while we're mentioning communication and anticipating coming on, Sean, onto the PPP, because I think as soon as people start talking to me about fake letterhead, I think scam. So, I mean, I can understand that you have levels of anti-vaccination opinion. So you have opinion, which is fair enough. People are entitled to an opinion and you can have a debate. If you have abuse, that's one thing. If you have misleading data, that's something. And you might wish to do some security around abuse and seek to argue back against misleading data. But as soon as you start seeing fake data, fake letterhead, I start thinking scam, and I then look to public protection and to our comms team. So we'll, Martin, pick it up when we get to comms, as to what we can do in order to get the message that this stuff is out there. Don't believe it just because it's on particular type of letterhead. This is what to look out for. So with that in mind, Sean, let's move on to public protection and what you're going to tell us about where you guys are, but let's just pick that one up as well. Thanks, Sean.
Thank you, Chairman. I'll pick that one up first, if I may. Yeah, I mean, clearly, basically, once you start getting into the realms of using fake letterheads, of recognised bodies and everything else, there's a whole range of certainly civil and potential criminal matters, depending on the intent of those. And actually, basically, if they relate to West Berkshire or any of the kind of areas actually covered by the Public Protection Service, that would be Woking and Bracknell, we'd actually like to see those if possible and take a view. So I'll move on to my briefing, Chair, if I may. I've just got 2 slides. I'm conscious of time, but I'll just give the board a quick update. Host disabled participant screen share, Jack.
Thank you.
Thank you. Okay. So I've just got two slides, one covering the issue of outbreaks, contact tracing, and then I've just got one just looking at the business position in the area. So the last 2 weeks, the number of local tracing calls has stabilised and fallen back a bit, as you would expect, as cases have dropped, as Matt's already set out this evening. So we've had 189 referred to us for West Berkshire in the last 2 weeks, of which we had 146 successfully completed calls. So that's around about 77%. So it's still holding up with quite a high response, given that these are the calls that were already not able to be completed by the national system. So I think it's still adding real value into the process on contact tracing. We have got 3 or 4 wards that we've identified where we're having less success. And ourselves and public health colleagues are going to have a look at that this week and see if there's anything we can do to improve success in those areas. Just moving on to the hub and the isolation calls, still very high levels. We are prioritising the ones basically which are the confirmed cases rather than the contacts. Obviously, with the new rules around contacts, it's not quite as clear in terms of isolation. We are getting still accelerated numbers of hub calls from where we were a few months ago. So they're running at about 5 to 10 a day, as are referrals as well, potentially to other agencies from either the hub calls or from the isolation calls that we're continuing to do. We're just in the process of a revamp, I suppose, a redrafting of the isolation guidance that we produced some time ago. Obviously, things have changed. So we're just taking a view from the various parties on the council's COVID coordination cell, getting that updated, and then we will start to get that out to the public. I mean, the information, the indication we've got so far is that it is still provided. I mean, we're not using the one we had, but people did find it of value. There's no workplace outbreaks in terms of, when I talk about workplace, I'm talking about what the board would probably consider to be traditional workplaces, obviously things like schools and other settings of workplaces as well. But the vast majority of the cases we've had reported into our monitoring system are from schools, basically kind of public schools, but also obviously the schools that Mark talked about earlier on. I mean, some early years cases, 1 or 2 isolated cases in workplaces, but nothing that you could identify as a cluster that would indicate basically an outbreak in those workplaces. And we are working basically with PHE on a small number of education settings, basically to and assisting where we can. So just moving on to business compliance and events. We're still supporting businesses with advice, and we're still carrying out some visits to higher risk settings. They tend to be still kind of more intelligence-led, so where we've actually either had requests from businesses to visit, or basically where we may have had referrals in from the public. They've fallen off significantly, but they are still coming in, and we're still carrying out those visits. Our visits are very much concentrating on the issues around staff testing. We're still looking to encourage that, and in particular in ventilation. And actually, if you just go, so in the last few weeks, actually, we have had new guidance on ventilation in workplaces that we have been rolling out to businesses, and trying and building that into our visits and advice that we're giving to businesses. But also in the last few days, basically new guidance on the safe use of public spaces. We've been notified that the licensing relaxations for off sales and things like the number of temporary event notices that were due to expire soon basically have been extended into the late summer, I think autumn of 2022. And along with those, I would imagine the relevant planning considerations around those issues, so outdoor table spaces and things like that. We are still supporting actually the event season, which is obviously traditionally very much a summer-based season. We are supporting still a significant number of event organisers actually in the West Berkshire area. So we attended we visited the one up at the Showground last weekend, the countryside event. And in fact, actually today we did actually have an advisory group where we talked to representatives of, for example, of the Michaelmas Fair, and the Victorian Fair that's coming up in Newbury, as well as things like Burfest. So that's still going on. I'm pleased to report that the COVID measures are still very much part of the event plans, and the risk assessments basically being produced by organisers, and still complying with the kind of government guidance around events. And finally, we are attending events on a risk-based kind of programme, and we will continue to do so basically into the autumn. I mean, the one challenge I think we've got at the moment is trying to get the staffing level. So here we were basically a couple of weeks ago with very high cases. The local contact tracing levels were very high. We were looking to recruit, they've fallen off. We are now basically looking to bring people back in. They have picked up in the last couple of days again. It is very difficult with the kind of up and down of kind of where we are in terms of local case rates or national case rates to kind of get that right. One of the things we are doing, so we do work across the authorities, particularly at weekends. And in fact, now we've actually brought colleagues from Wokingham and Bracknell councils into our kind of weekend response, basically where the cases tend to be higher in terms of local contact tracing, to work as a three authority partnership on that. So that's my update, Chair. I'm happy to answer any questions.
Thanks, Sean. And Councillor Masters.
Thank you, Chairman. Thank you, Sean. This question, while I think there's some relevance about ongoing testing of staff in the businesses that you're advising, etc., it might be a question that other people in the meeting might be able to elaborate and give a bit more detail. In terms of the lateral flow testing and the regular testing of staff, is there any provision? Are we doing any publicity about making sure that people know to register? Because I had some feedback from some of the community events, and it may be that it might be the ethnically diverse communities where language is, English is not the first language, about registering. In your work directly with businesses, do you get the feedback that people are registering diligently when even on a negative test for that sort of data? And I don't know whether Martin's doing anything in terms of communication regarding those hard to reach communities to make sure that people are registering when they have a lateral flow test on the NHS app, as many of us do regularly. So that was a question that I felt maybe Sean and Martin might be able to do, or anybody else who feels that they can.
Yeah, so we are encouraging people basically there are various sectoral guidances, as you're probably aware, Councillor, for different types of business and different settings and activities. And a lot of that talks about these issues around testing and registration. And we do push that. What I would say actually on the testing front, so particularly when we've had conversations with event organisers and things like this, they are all encouraging staff to test on the day, basically, for events, and that's really, really encouraging. I think Matt may be best placed to pick up the point about the other point that you made around recording that. I think you've got your hand up there, haven't you?
It's just a quick one. Councillor Masters might know we're working closely with Healthwatch and Community United to we've actually commissioned them to work alongside Solutions for Health to do targeted testing and reach those vulnerable groups. So that's the first point. So we're happy to take those comments on board and take those away with regards to businesses. In terms of recording tests, I mean, that's always a tricky one. I mean, firstly, let's get people to take a test, and then it's really welcome if they record it. The challenge we've got anyway with a lot of the recording the tests is people don't always disclose where they work. It's a real gap in the data we get, and that's been an issue throughout the whole of the pandemic. But we have tried to get people to encourage that. But yeah, we'll certainly take that away and progress that. Is
there multi-language leafleting? I know in the lateral flow boxes, it's quite explicit in English. Is there different languages available in lateral flow testing packs? Is that something that happens, or is that a supplementary leaflet or information that can be shared with those communities?
That's a good question.
And I would just like to say, I think that I think it's great that you are. You have contracted out to people like Community United, because I think that is having a very positive effect from the feedback I'm getting locally myself. So thank you for that, Matt.
Yeah, in terms of languages, I don't know the answer to that. I hope so. If not, I'll certainly look at that, because I think that's really important.
I think in terms of the thank you. Yeah, I was just going to say, in terms of the comms around this, obviously, Chair, we're going to come on to comms, but that may be something. I think, as Matt said, is that the most important thing is to get people to test, and we do keep encouraging that at every opportunity, basically, when we engage with businesses, and particularly events where you may have significant numbers of people attending. Thank you.
Yeah, I'll come on to comms. I note that the 119, obviously you've got to get people to ring 119, but there are apparently 200 languages available through 119. So, I don't precisely how that works, but you've got to get them to phone it in the first place. So I take on board entirely the difficulty of getting that connection with those for whom English is not their mother tongue or first language. Martin, knowing the time, over to you to give us a comms update.
Thank you very much. Hint taken. We've covered much of what I was going to update on in the course of the meeting anyway, which will allow me to move through my update at a fairly brisk pace. So since we last met, the priorities for us have been really around raising awareness of the rising cases, which we've seen over the past couple of weeks, which Matt spoke about earlier, just reminding people to be vigilant. We tied that in as well with the publication of the new autumn and winter plan, and a reminder that actually this is going to be something which is going to be with us through the winter months, and something that we very much need to be mindful of. We've also been promoting the Health on the Move bus. It's been to Thatcham, Newbury, Hungerford, to name just a few places as well. And of course, supporting the Public Protection Partnership with the work on the self-isolation packs, because even though much of the self-isolation rules did change in the middle of August, it's still a requirement in some cases, and that pack has been, as Sean said, really important. So coming up for us over the next few weeks, couple of months, we've got as I said, the autumn and winter plan. So we need, as a comms team, just sit down, have a look at that, see what that sets out for us in terms of comms likely to be coming down the track into the colder months, and making sure we're prepared for that. And hand in hand in that, we're sort of recruiting to some additional resource in the comms team just to get us through the winter months through to March next year, while it's steady-ish at the moment, conscious that it could get busy again. We want to make sure we've got the resilience there to stand things up again if we need to. continue to promote the Health on the Move bus and the assisted testing options, which Matt just spoke about in terms of Health Watch West Berkshire, Community United and Solutions for Health. And of course, supporting the booster programme as it rolls out as required in the vaccinations for the 12 plus people as well, and schools, of course. And I'll take the points which we've picked up on through the course of the meeting around the sort of the messaging coming from anti-vaxxers. We've seen some of that on our social media posts as well when we've been sort of talking about this. That sort of seems to attract sort of some negative comments on occasion, which is disappointing. I'll speak to both the Public Protection Partnership and colleagues at Thames Valley Police if the police are looking into it as well, to see if they have any advice. Any content that we can share, just to let our communities know to be vigilant about what they're reading and to make sure they're comfortable about the source of the information they have. And also the point around continue to register lateral flow test results as and when committees do them. So in a nutshell, and as you say, Chair, mindful of time, that's my update, but happy to take any questions.
And I see no one burning to ask you one. So members, the next item on the agenda is future agenda items. Now, in fact, what I'm going to do is I'm going now to look to Matt and Meriden, because obviously the numbers have been falling and coming down. We deliberately put into our revised terms of reference the ability of, between them, Matt and Meriden, to advise to stand down or stand up LOEB as the circumstances dictated. So over to you two to comment on where you think we are with this board.
I am happy to go first. I mean, Meriden had a bit of a chat earlier, really, and obviously the last meeting, our rates were significantly different to what they were. So I think we probably shared a view, and I'll be interested to get the views of the board, is whether we stand down LOEB for now, based on the revised terms of reference and the escalation criteria. But the caveat to that is whether we utilise the Health and Wellbeing Board and have a standing item on that board to actually give an update on COVID-19, given that's also a public meeting. So I don't know if Meriden wanted to add, but I think that was a conclusion we come to, but equally happy to hear what others thought of that proposal.
Yes, I think, Chair, I think this board has very well served the purpose of members considering the data, considering the information, and being involved in the decision making and holding people to account in public. And it's been really good. I think we're at a position now where, even though we're still in the pandemic and it's likely to continue for a number of months, there's a lot of much clearer advice and guidance and less of local decision making. So I think the Health and Wellbeing Board is possibly the place where we could still continue to talk to the public and in public, and could review the data. So I think there's still a place for reviewing the data. There is still internal processes, but I think that I'm not sure that we really need to continue with the local outbreak engagement boards as they are at the moment.
Right. Members, what I would suggest, firstly, we do have Health and Wellbeing on the 30th, and I would certainly be keen, because that may have a subtly different audience to this board, keen to have a brief, because we've got a fairly busy agenda on the 30th, a brief update on where we are with COVID. Having said that, we've also deliberately skewed the terms of reference so that essentially, the way I read it, it is a decision of our Service Director for Communities and Health Wellbeing and our Director of Public Health as to whether or not they feel that this board needs to meet. I would suggest that we leave, if you recall, we put a meeting in, moved it 3 weeks, then we made this meeting, which was supposed to be yesterday, but there was a clash. As it turned out, there was another clash tonight that wasn't on the calendar. So, for example, the leader isn't here, Councillor Bowick isn't here because of that clash. But I'm told there isn't a clash for the 4th of October, which is in a fortnight. What I suggest is we leave the 4th of October penciled for the moment, And in a week's time, between the Matt and Meriden decide whether we should be meeting. And we circulate an email to tell you whether you're meeting on the 4th or not. And in the meantime, we then have that update at Health and Wellbeing. Councillor Masters, so did you want to speak, Councillor Masters?
I was just going to say that I think that's a really good idea, Chairman. I think with the fluctuating situation over the last few weeks, there's nothing to say that something may arise, and I think it is prudent to review in about a week's time. So I would second that.
Councillor Moore.
Yeah, thank you, Chairman. And I mean, I'm new at this, so this has been the first one that I've observed. But it just struck me that the issues potentially over the younger people that was extensively briefed. That was really helpful. That's a new dimension to the issue. And so I would support your suggestion.
So, unless anyone's going to violently disagree with me, that's what we will do. So, can I thank Councillor Stewart from the bottom of my heart for having taken over at the start of this? I appear to have 2 computers that are working. Astonishing, isn't it? So, thank you, Councillor Stewart. Members, if you'd like to state Meriden, you put your hand up. Did you know you'd put your hand up? No, you're taking your hand down. Okay, we'll take that as a false hand. So, members, if we'd like to stay in the room until Jack confirms that the meeting has ceased streaming.